Hello, I'm Jaimin Bhatt, consultant urologist here at Rosshall Hospital in Glasgow. Today I'll be sharing some key information about having a flexible cystoscopy, which is a common test to look inside your bladder and diagnose conditions affecting the lower urinary tract. If you'd like to know more in-depth information about this test, you're in the right place. I'm here to share my expertise about the test so that you can feel ready and informed before having it. So, what is a flexible cystoscopy? This is a test to look inside your bladder and water pipe and diagnose the cause behind unusual urinary symptoms. Why might you need this test? A cystoscopy is a highly effective way of investigating a broad range of bladder problems such as blood in your pee, recurrent UTIs, pelvic pain, and troublesome urinary symptoms. Your consultant will look for certain causes of these symptoms, the most important of which can include tumors of the bladder. The most common symptom for bladder cancer is painless blood in your urine, whilst other symptoms include recurrent infection-like symptoms not clearing with antibiotics. Sometimes your GP may detect persistent blood in your urine sample that is not visible to the naked eye. Other causes of bladder symptoms include bladder stones, which are lumps of minerals that can build inside your bladder when it is not completely empty of urine. These can cause distressing symptoms such as burning in your pee, lower abdominal pain, difficulty peeing, and blood in your urine. Other conditions of the bladder that can be detected at a cystoscopy include cystitis, which is inflammation of the bladder lining, or rarely a fistula, which is an abnormal connection between your bladder and another organ. Sometimes a cystoscopy is also required to remove a stent from the kidney tube following kidney stone procedures. It can also be used for difficult catheter insertions as well as for certain treatments such as Botox injections in the bladder. There are many reasons why you might need a cystoscopy. Your consultant will usually tell you whether they suspect any particular condition before the test, but they can only definitively diagnose it with this test. What is the difference between a flexible cystoscopy and a rigid cystoscopy? There are two main types of cystoscopies, which are a flexible cystoscopy and a rigid cystoscopy. The main difference between the two is how they are performed. A flexible cystoscopy can be performed in an outpatient setting using a local anesthetic whilst you are awake using a fine flexible scope, whilst a rigid cystoscopy is performed in an operating theatre usually under a short general or spinal anesthetic. The most common indication for a flexible cystoscopy is diagnostic, whilst a rigid cystoscopy allows various therapeutic procedures such as removal of bladder tumors or treating bladder stones. How is a flexible cystoscopy performed? Your consultant and nurses will ensure you are comfortable. They will place a sterile sheet over the lower half of your body before your specialist applies a local anesthetic gel to your urethra or water pipe to numb it. Next, your consultant will insert the cystoscope into your urethra and, using water to guide safe and comfortable passage, gently move it into your bladder. If you wish, your consultant may share the screen with you and explain what is happening during the cystoscopy. How long does it take? A flexible cystoscopy usually takes only around 5 minutes or less to perform. Is a cystoscopy painful? A cystoscopy should not be painful, but it can feel slightly uncomfortable. You might also feel like you need to pee during the procedure, but this will only last for a few minutes. You can also tell your consultant if you feel any discomfort and they will stop the test at any time. What is the recovery process like? You can leave hospital shortly after the cystoscopy, but you will need to make sure you can empty your bladder properly in hospital before returning home. If you're unable to pass urine, you will be asked to stay in hospital until you can. When you are ready to leave, your consultant will answer any questions you have about recovering at home. How long should you rest for after the test? You should be able to get back to normal everyday activities, including work and exercise, around about the day after a cystoscopy. Your urethra might feel a bit sore at first, and you may need to pee a little more than usual, but this is quite normal. You may also find that it stings when you go to the toilet, and some people may see a bit of blood in their pee. Don't panic because this is common, but it is important that you drink plenty of water following the procedure to flush out your bladder. As you urinate more, your urine will return to normal. We recommend you drink plenty of water or squash in the hours after the cystoscopy and to avoid caffeine and alcohol for a couple of days. If you experience pain or discomfort following your cystoscopy, you can manage this with rest and traditional painkillers. If your symptoms persist, seek medical advice. What are the next steps in your treatment journey? This depends entirely on your situation. If your consultant has diagnosed a condition during the flexible cystoscopy, they will begin building your tailored treatment plan and discuss your next steps. They may also provide written information to take away. If you have any concerning symptoms, such as blood in your pee, and you would like to discuss having a flexible cystoscopy with me in more detail, you can book an appointment with me or your nearest consultant at circlehealthgroup.co.uk. We hope you found this video useful, and don't hesitate to leave any questions in the comments section below.